Hello, Miss Gibson. My name's Dr. Friedlander. I'm one of the doctors on this ward. I need to do your admission now, if that's all right.
Yes, that's okay.
Great. First, I'm going to ask you some questions about your medical history. Then I'll do a physical examination. Are you comfortable at the moment?
Yeah, I'm okay.
Can I get your personal details first? Can you tell me your full name, please?
It's Kaylee Gibson. My middle name's Suzanne.
Right. Sorry. Can you spell your first name for me, please?
Sure. It's not a very common name. It's Kayley.
Thank you. What's your date of birth?
16th of September 1982.
Okay, thanks. Can you tell me what brought you into hospital today?
Yeah, I was just at home having lunch with my family. We always have Sunday lunch together. And I got this awful pain all of a sudden. And it was so bad, it took my breath away.
Uh-huh. So, the pain came on suddenly. Can you show me where the pain was?
Here, on my right side, at the top of my stomach.
Have you still got the pain?
No, it's gone away, but it was really bad. And I was a bit worried about it.
Yes, I see. Have you had the pain before?
Yes, I have. I seem to be getting the pain on and off after I eat, especially after fatty food.
All right. I'll take a look in a minute, but I'd like to ask you some questions about your general health first. Is that okay?
Yes, that's okay.
Have you had any health issues which required hospitalization before?
Well, I came into hospital a month or so ago with the same pain. Other than that, I had my appendix out when I was a kid. I think I was 9 or 10. Oh, and I broke my leg badly and had to have it fixed. That was 3 years ago. It was a work accident.
Okay. Are you working at the moment?
No, I took a leave of absence to go back to uni. I'm doing my master's. I was working in hotel management before.
Right. Do you take any regular medication?
No. The only thing I take is an antihistamine for hay fever in spring. I did get some antacids mixture from the chemist for this pain. Does that count?
Yes, it could be important. I need to know about any medication, whether it's a prescription medication or an over-the-counter medication. The information will help me make a diagnosis. Would you mind telling me about any other drugs? What about recreational drugs, for example?
No, not really. I smoke a few spliffs occasionally, but that's it.
Thanks for telling me that. I really appreciate your honesty. And regular cigarettes, are you a smoker?
Not anymore. Can't afford to smoke now I'm back at uni. I gave up, must have been at least 4 months ago.
Right. How would you describe your alcohol intake?
I don't know. Normal, I guess.
Would you be able to tell me if you drink every day?
Sure. No, I tend to have a few drinks with my friends on the weekend. Sometimes I overdo it, but not often.
So, you wouldn't say that you're a binge drinker?
No. I'm a social drinker most of the time. 4 or 5 drinks max. And only on a Saturday and maybe Sunday.
I see. Okay. Thanks. That's very helpful. Do you have any allergies?
Only penicillin. I've avoided penicillin since I had a reaction when I was younger.
Okay. What happens if you have penicillin? What sort of reaction do you have?
It's not life-threatening, but it's not very nice either. I get a really itchy rash over my whole body.
Right. I'd like to ask you about your family history, if I may.
Their medical history, you mean?
Yes. Is there any history of major illnesses like kidney or heart disease or diabetes?
No, nothing like that. Well, my dad has high cholesterol, but he takes medication to lower it, so I don't think it's a problem. My sister has some mental health issues. She suffers from bipolar disorder, but it's well managed and she seems okay at the moment.
OK. Thanks for sharing that information. I'd like to do a full examination now, if that's all right with you.
Sure, no problem.